This is the frog stretch for the adductors. It's a moving stretch, so it catches different parts of the adductors. So the adductors is the groin muscles on the inside here. So have your feet touching at the back. So they're touching like that. Then open your knees wide as you comfortably can. So my hips are in line with my knees here, so I'm not forward and I'm not back just yet. So I'm in line here. So I'm opening that as wide as is comfortable. Pressure through the arms, and then so there'll be a stretch already. Then you sit your weight back, so it'll make the stretch a bit deeper and make it change position a little bit. Then come forward. You can go past the line of the knee, hips past your knee line, and just keep sitting back. And you're keeping your back flat or arched even is okay. So what we don't want is the back to round out this way as you go back, because it'll lose some of the stretch. So your back either stays flat and doesn't change, or you have a bit of an arch in your back that you keep, and you'll find that's the strongest stretch in the adductors. So to do 5 of those, sit forward, sit back, and then you'll better open your knees a bit further. Your feet might start to not touch anymore, that's fine. So you feel the stretch in the adductors through here, and then sit back again, and it'll change the stretch again. And there should be no pain, there should be no pinching with this in the front of the hips at all. So you're keeping this stretch going for at least a minute and building up to 2 minutes over time. When you come out of it, take pressure through your arms to come out of it. So some ways that you can progress this stretch and make it a little bit different and make the stretch go more to one side. So you're opening the knees, you got that sit back, coming forward, and then you're reaching over to one side. So I've just got finger pressure on the ground here, and I'm reaching over into this side, and it'll stretch more in this adductor here. And I'm changing sides. Changing sides. And as I'm doing this, I'm letting the legs relax. So relax here so they start to slide apart more. This is a very grippy surface. On a slippery surface, the knees just want to keep opening. But sometimes I'm also putting a bit of pressure between my knees. So I'm trying to squeeze my knees together. So I'm putting pressure into the ground so the adductors will work. So I'm keeping some strength in the adductor as I do this too. So we're allowing it to contract in this stretch position. So I'm keeping it a little bit contracted, maybe about 1 or 2% of my strength. Then I'll just come forward a little bit, allow that to slide out a bit more, sit back, go over to this side again. So I'm just repeating this for 1 to 2 minutes. So to load this stretch more without putting weight on it just yet, so if I want to stretch my left side here, so the moment I have my hands sort of evenly placed, so there's an even distribution of weight and pressure through my hips. But if I put my right hand forward and out more towards where my right knee is, then when I lift this hand, pressure goes into the adductor, actually works here. So I've got to take the pressure through the body. So I've got some weight going through there. So it's actually good. So push strength through a stretch position. And then I reach out this way and start to bend this way, not putting much pressure through my fingers at all. So like all the pressure is going through this adductor, through this knee and the adductor muscle here. I stretch that. And then I pop this hand more in line with the knee on the left. Lift this one. I feel the pressure go into the adductor and into the knee on the right side, over here. Fingertip pressure. So I've got a contraction that has to work through my adductor. And I just keep changing that. So now I've got pressure through here, through this knee. So it's a strength exercise as well as a stretch. So it's teaching the muscles and the nervous system it's okay to be in this new range. We've contracted in this new space and the brain knows where it is. So I'll do that for 1 to 2 minutes. Then come up, have a rest. And as always, when you come up, use your hands to take the pressure out of the hip joints. Come in, stretch a little bit, tuck the pelvis under, open the front of the hip joints, stand up, walk around for 30 seconds to a minute, and then do your next set. So how to progress this, it's just like weight training. So you're doing progressive overload. So start off with a light weight and gradually increasing by a couple of kilos at a time over the course of weeks and months. So I've got a 5 kilo weight here. You might even start off with 1 or 2 kilos. So these bigger weight plates are more useful, more easy to use, unless you've got someone to put it on your hips. So I pop this on my back, on my hips here, open my knees to where it is comfortably wide, come forward so that it doesn't slide off me, and then I'm just keeping the weight of that will make a pressure in my legs, and I'm trying to pull my knees together, so there's a bit of a pushing with my knees into the floor, so there's an activation of the muscle. And then I do what I did before, so I'm popping this hand out to the side, so it's not in line with my center line, so I have to take weight through here more. Little light touch here, coming up. Can do that a few times, get that left adductor working, the hand about in line with my mid-thigh here, and same with this side. And I'm doing that for 1 to 2 minutes and gradually opening the knees more, and you'll find you can open up more and more. So you can play with the alignment, so your hips can be in line with your knees, they can be a little bit back, they can be deeply back. If you bring your hips forward of your knees, the stretch feels different because now it's stretching into the capsule of the hip. So the hip joint itself, that's why it feels different. So you can hang out here a little bit, but you're not trying to force this too much. You're better be in position where your knees, where your hips feel there's a muscle stretch. And then to come out of it, just open your feet, let that fall back. What can be very useful after doing that is to get internal and external rotation moving in the hip joints again. So you're just on all fours, your back flat, and then you're getting one leg, taking it around as much as possible and around this way as much as possible without your hip moving. So you can move your hips and do this, or you can make it isolated where it's just coming through the hip joint itself. So we want that. So you're using your muscles to try to push that around. No hip motion, no spine motion at all. So it gives feedback back into the pelvic floor muscles, the go-go's, obturator internus, externus. Quadratus femoris, all those muscles there. And then we do the same the other side. And if you like, you can get a TheraBand or power band and put that around your ankle and have a bit of resistance. So you just tie the band off to something at the side, but it's a bit of maneuvering around. This does a good job at just priming the muscle again after you've stretched it so far, because the body likes knowing where it is. And if something's being stretched further than usual, it kind of the brain loses a sense of where that was. So getting it contracting again helps, and the joint doesn't feel like it's compressed, or you're getting joint pains over the course of days and weeks of loaded mobility sessions.